Well, thank you, everybody, for coming. We, over the last several months, we've made some major changes within the Albuquerque Fire Department's procedures on the way we handle emergency responses, take care of taxpayer resources, allow our great men and women of the Albuquerque Fire Department to respond to calls that are in a more efficient way and in a way that makes a lot of sense for our community. One of the first things we did several months ago was we, through Chief Breen and his staff, we are in the process of doubling the number of paramedic units in the Albuquerque Fire Department by buying the equipment, doing the additional training to allow our firefighters to be paramedics, and so that we can lower response times and have more capabilities from the paramedic standpoint. Just a couple of weeks ago, we also introduced the Public Inebriate Intervention Program, PIP, which is a collaboration between the Albuquerque Fire Department and the Albuquerque Police Department to basically help individuals in our community that are in crisis so that we can use our emergency response resources for emergencies around the city of Albuquerque and save time in emergency rooms. And we had a great collaboration between MATS, which is a county-run facility, and the Albuquerque Police and Fire Department. Well, today we're going to announce a study that we're going to be doing over the next several months for a program that's called Community Paramedics. And this is a program that we think would have great service to the community if the study shows that it actually works well for the citizens of Albuquerque. And the way it works in general, and I'll let Chief Breen and Dr. HARRELL talk about some more of the specifics, but in any city of a size like Albuquerque, we have individuals who have a great need for services in the community. And some of these individuals will call for emergency services time and time and time again, when in fact maybe the services that they need that particular day aren't emergency services. So the study that we're going to be doing is we're going to be talking about training our officers as our fire department firefighters, several of them as community paramedics. Put them in a standardized vehicle, maybe a sedan or some other vehicle that's not a fire engine or a normal emergency response vehicle. And we're going to work with the hospital systems around the city, with the ambulance services around the city, help identify these individuals who are in great need of services, and be able to put an Albuquerque firefighter who's been trained as a community paramedic in place to work with them individually so that they can get better care, better response times, but we're not making the response times with some of the heavy emergency equipment that we have. And I think it shows a lot of possibilities, and I was excited when Chief Breen brought up the concept, and we will be, after today, launching this study to do several things to make sure that this fits well within the Albuquerque Fire Department. We'll be working with firefighters, and Dr. HARRELL will be saying a few words, who's our medical director of AFD as well. And we're going to be talking about the possibilities of this great program. So with that, I'm going to allow Chief Breen to give you a few more of the details, and then I'm going to have Dr. Drew HARRELL come up and say a few words as well. Chief?
Thank you, sir. Community paramedicine is a very innovative approach in addressing some of our emergency response needs within our community. It's being tried in several communities around the United States. There's no perfect model right now, but we're going to study to see if it fits our community. And it has the potential to better connect our community medical resources and improve relationships with our community, and hopefully it's designed to improve patient outcomes. I'd like to introduce AFD's medical director, Dr. Drew HARRELL, to say a few more words about it.
Thank you, Chief Breen.
Yes, sir. Introduce yourself too, so the UNMH side of things.
Sure, absolutely. So good afternoon, everyone. Happy 5th. My name is Drew HARRELL. I'm an emergency medicine physician at the University of New Mexico and the medical director for the City of Albuquerque Fire Department. And I'd like to just take a moment and actually comment upon a real-world example of this community paramedicine that has actually developed already through some very good collaborative approaches that we have with both APD as well as our community partners, Albuquerque Ambulance, and the area facilities. And it works well and dovetails nicely with ABQ Heading Home, the initiative that we've worked very hard to help with homelessness within the population here within Albuquerque. An individual that was placed as the 200th individual within the ABQ Heading Home was identified through community paramedicine work by Captain Chad Kim and Miss Jody Jepson, who's associated with APD's Coast team, and really was a high utilizer of emergency services and developed and actually created lots of 911 responses. And once we were able to identify and appropriately place this individual into contact with the appropriate community services, we were able to help him with recurrent problems that were chronic in nature, but were easily able to be fixed with just a little bit of legwork by Captain Kim and by Ms. Jepson. And he's now living in his own residence, has in essence not really contacted the 911 emergency services since his placement. And this is in essence the perfect example of what we hope to look at and see if we can improve upon and develop a program here within Albuquerque that will continue to help the citizens and improve our service delivery model. Thank you.
Thank you, Dr. Harrell. Appreciate you. Just to give you some ideas on dollars and cents, that 200th individual that was placed in Albuquerque heading home, I've met the individual, wonderful person. Has some issues that required them calling. You know, they were living in crisis on the streets of Albuquerque. That individual, in the 90 days prior to being placed in Albuquerque heading home, I believe had 82 calls for emergency service. If you take those calls for emergency service and add up the total costs, not even including necessarily the emergency room costs of that, it was over $145,000. Well, we can place someone in heading home for 22 years. For the cost of that. Now, we have other individuals, and we don't, part of this study will be to identify how many individuals we have in the community, but in discussions with Dr. Harrell and with Chief Breen, I don't think it would be out of line to say that there are probably several hundred people in our community as we speak today who could very much take advantage of this community paramedic situation, help them get their health care needs taken care of without using the emergency medical services. And then, of course, by doing that, it saves tremendous amount of taxpayer resources and, frankly, gets them better care. So we look forward over the coming months to the study that Chief Breen and Dr. Harrell will be commissioning to see if this is right for Albuquerque. It looks good on the surface, but we want to make sure that all the details are in order before we proceed to a full-blown program in the city of Albuquerque. That, I know these gentlemen may have a few questions, but one of the things that I would like to do before we go to questions is on your way out today, if you'll take a look at one of our brush units out here, this truck right behind you with the red and white. I don't have my distance glasses on, I can't read the unit number, but you'll see it. Oh, it's right here. I'm sorry, there's one right here on the door behind me. As you know, on June 30th of this year, 19 firefighters from the hotshot crew from Prescott, Arizona, were killed fighting a fire in Arizona, the Granite Mountain Fire. And we just, at the Albuquerque Fire Department, wanted to make sure that we're honoring these individuals for their bravery, and it's just a constant reminder to us as citizens that these ladies and gentlemen that go out on a daily basis, that fight fires, that protect us on the streets of Albuquerque and streets across the country, they have a dangerous job, and this is a very sobering and humbling reminder of that. So the city of Albuquerque is proud to be able to put this commemorative decal on our fire equipment to remind us on a day-to-day basis, but also to remind our community just how dangerous this job is, and to pay honor to those individuals and their families from Arizona. Do you want to mention anything more?
Jeremy.
Yeah, Jeremy, let's please introduce yourself if you will.
I will. My name is Jeremiah Hansen. I'm actually the Fire Management Officer for the Albuquerque Fire Department. And as the mayor has said, and we've mentioned a few times recently, June 30th, 19 of our elite firefighters in the nation, some of which were very dear friends of some of us, many of which we had trained with, fought fire with, excuse me, stood side by side with many days and died. This is a tragedy that is 80 years in the making. And it goes back 80 years before you can find a time that we have lost this many people. That being said, something we wanted to do to show those of our brothers and sisters that we are still honoring them, and we honor them every day through our service, was put this decal onto all of our wildland apparatus. In addition, it's a reminder to all of us each day what we do, why we are here, who we serve, and at our heart, why we do it. So we appreciate that, the time to mention this, and we'll take questions later if you have them.
And just on one final note, thank you, Jeremiah. We call him Jeremy. He goes by Jeremiah. Jeremiah is one of the absolutely stellar members of the Albuquerque Fire Department. Not long after I took over as mayor in the city of Albuquerque, we had a bosque fire down by the Hispanic Cultural Center, National Hispanic Cultural Center. And that was my first chance to be introduced to Jeremy and his crew. And I can just tell you something, we've got one of the finest wildland firefighting crews in the country, and Jeremy's somebody that I trust. And when we start talking about bosque closures, we start talking about the conditions of the bosque in the foothills. Chief Breen and Jeremiah are right there giving me advice as a mayor. We appreciate you very much, and we know this hits very close to home. Thank you for doing this in honor of the firefighters in Arizona, and be safe out there, my friend. With that, we've had a lot of information this morning on lots of different things. If there's any specific questions, we'd be more than happy to answer those. If we can, yes.
Mayor Berry, approximate cost of this study, and is this done with an eye on cutting both response times and possibly staffing, or what's this done?
Well, the study will be done with our internal staff, so we'll be looking at best practices around the country. We'll be looking at our internal resources. So I don't believe that we have an outside consultant that we're bringing in on this study at this point. So it'll all be done with existing taxpayer resources. And I think the answer to your question is this is the best of both sides of the equation, I think. It'll help us provide better medical services for those who find themselves in situations that where they feel like they need to call emergency services frequently, whether or not their call that day is an emergency or not. So they're going to get better health care. Our community is going to save money because instead of sending out an apparatus like you see behind me here, fully staffed for a non-necessary or non-emergency call, we'll be able to send out a properly trained Albuquerque firefighter to go and work with these individuals, but also to help connect these individuals with others in our community that can help them, whether it's through existing healthcare services, existing hospital services, whatever it happens to be. We've got many great programs in the community. So yes, it's better for the individual who finds themselves making frequent calls. It's also better for us because it'll save valuable resources and have better outcomes at the same time, which will allow our other emergency responders to respond to emergencies faster and more efficiently, which also is better for the community overall because it'll help reduce response times.
Yeah, where have we seen this work the best, and what do you see as the biggest advantage?
Well, actually, this is kind of the emerging program throughout the United States. So Seattle, Tucson, there's a number of communities that are experimenting with this. And really, it's about case management. It's identifying individuals that have a reliance on the 911 system for non-emergency purposes, and it allows us to deal with their situation or their needs more efficiently using more affordable resources. And what's going to happen is it means that we'll have better response times because the trucks won't be tied up on these calls, and these individuals will be better connected to the medical community, and they're going to be healthier, and it's going to decrease the amount of ER visits and as well as the number of admissions to the hospital. So, and that's all it really is case management. Okay.
When might the study be done or decision made?
Well, it's something that we'll be studying over the next 90 to 120 days. And then we'll start to develop when those strategies are developed. We'll set up a kind of a pilot program and using best practices that have been identified throughout the country and what we think is going to work here. And it's really a practical approach, again, to case management.
And I told Chief Breen, like some of these other initiatives that we've had, the program for public inebriate intervention, the PIP program, we started talking about that, I think probably during the transition when I came into the mayor's office, and we were able to implement that. It took us several years to get there. So I've told Chief, study it, start working on the system, but let's make sure we're comfortable before we start moving forward. So I haven't put a 90-day or 120-day emphasis on this with Chief. I'll let him study it. When he and Dr. HARRELL and the rest of the Albuquerque Fire Department are ready to bring this forward as a pilot program, that's when we'll do it. But I don't want to rush them. We want to do it right rather than fast. But we think the study can be done. I would say a more accurate time frame would be several months.